Hi everybody, welcome back to another episode here at Excelsior Orthodontics. My name is Dr. Minh. Today we are going to take a look at the latest Journal of Clinical Orthodontics article, and we are going to talk about actually a very popular growing appliance called the MARPE, or what's known as the mini implant assisted rapid palatal expander. It's kind of like that RPE expander that you know with the key that you do on like kids and teenagers. Only this one a little bit more intense. I'm going to walk you guys through it. We're going to take out this really cool article that just came out, and let's dive right on in. But before we do that, be sure to click the like button, hit the subscribe button, help me grow this channel. It'd be a big help. Stay tuned for like future episodes about all things orthodontics related, clinical cases, articles, reactions, and so forth. Okay. Bone-borne maxillary expansion here, a clinical report of potential changes. So, what is a MARPE? Just cut to the chase right here. A MARPE right here, I'm going to walk you guys through it, is actually this thing right here. It is a skeletal expander where it actually uses 4 mini implants that are placed in the palate of the mouth. Why opt for something so aggressive like this one sometimes? Well, due to skeletal maturity is the rate limiting step here. If the patient is quite older, let's say over 14, 15 years old, the limitations of a regular expander start to get quite tested, and it might not entirely have the entirely predictable positive effects that you may imagine. So you need to have what's called skeletal anchorage, where it takes 4 mini screws that go into the roof of the mouth, and that way it holds onto the bone itself, and you can still actually what we call split the maxilla. So separates the upper jaw slightly in half, and that way you can have a skeletal expansion and not just risk putting braces on a patient and tipping the teeth out of bone here. Current approach is bone-borne device, mini screw assisted rapid palatal expander, appliance first or bone first. CAD/CAM. Here we go. Although MARPE designs and TAD insertion sites have been proposed, some authors have concluded that the available evidence is too limited to strongly support this method over conventional alternatives. Most studies to date have focused on the success of MARPE in splitting the maxillary sutures. The older the patient, the more advanced the bone maturation, the less successful these appliances seem to be. Empirically, yes, I agree with this. In my experience, that's what I've seen. The older the patient gets, the more dense and strong that bone is. It just kind of holds on really tight. It's really difficult to get that skeletal expansion that you may need.
Come on, do it! Do it!
Interestingly, an aspect that's rarely discussed in literature is the occurrence of problems, errors, and failures and unwanted side effects associated with the MARPE. Reported issues include inflammation, pain, pulpitis, appliance malfunctions, and broken TADs. Facial asymmetry has also been noted. Yeah, so many people want to show cases where they're like the most perfect, the most beautiful thing. Hey, I tried this crazy appliance. Not that I'm saying the MARPE is crazy, but they say they try some crazy technique that's just so different, and it just happens to work, and then they feel like geniuses. Everybody wants to show those cases. Nobody actually wants to show the things that could kind of be like unwanted. Exactly it. You know, some of the things you just did not expect to have happen to a patient. This research is centered on the MARPE and associates unwanted side effects. It wants to find the catalyst for stimulating discussions, further research, open dialogue. This is great. Awesome. While we do not claim to offer comprehensive evidence, we want to emphasize the importance of technique with this careful consideration. Obtaining informed consent, assessing cost-benefit ratio, principle of do no harm. Exactly it. And now you still have to be a doctor. Yes, there may be cases that work out great, but patients have to be informed of the risk. Patients have to be informed that, you know, this might not entirely work, but it also work wonderfully. They have to just be informed. That's it. If it's informed, it's okay. Say it's worth going for it. Side effects can be divided into operator related, TAD related, host related. So the provider, the appliance itself, or the patient itself. TAD related events. The most common problem related to TADs is loss of stability, with posterior TADs being more frequently than anterior TADs. Another issue is TAD fractures. So when the actual mini screw splits in half. Both events are difficult to detect. Most common sequelae involves soft tissue impingement of various parts of the MARPE appliance. Here we go. If the MARPE is not purely in the bone itself, a TAD failure or a tooth anchored attachment failure can lead to significant periodontal problems on the anchored teeth. What this means is, if we take a look at the picture here, here's a 3D image. There are the 4 screws, like so, that are placed in the roof of the mouth. The MARPE is predicated that the pressure is only going to be exerted on the screws itself. So this is a good example where typically sometimes appliances will actually connect the MARPE appliance to the teeth as well, but this one is just purely in the bone. Here's a great example of it already inserted, and here's an example of some of the complications. They definitely did not anticipate this, where the mini screw cut or fractured, and now the appliance will continue to expand, but it pushes up against the soft tissue. Okay. All right. When a TAD becomes loose, it can become painful to the soft tissue impingement, requiring removal of the appliance and construction of a new one. In this case, a fixation screw cap became disconnected from its thread during the installation of the new appliance, resulting in a screw cap failure. There we go. Worst case scenario is a TAD fractures due to excessive load. So there's just too much pressure on the TAD itself, and it's just trying to hold up. During the insertion or MARPE activation, this patient was suturally maturation stage D when the TAD fractured. So there's another article that describes the skeletal maturity of patients, and this is probably most likely a later stage where they're very skeletally mature, and the TAD, what it means by activation is when the expander is actually turning, and the patient does this and it turns, it's generating the force on the screw, which thus puts pressure on the TADs itself, and that could lead to, let's say, too much pressure, and then just fracture. It just gives. So unless the bone gives, the screw itself may give. So you can see right here, looks like it was split right there. Now the end of it is actually inside the patient. That's one event that could happen in the TAD itself. Appliance related events. Here we go. So let's look at the appliance itself. Let's take a look. MARPE appliances are secured and TADs are fixated screwed with a bonding agent. The expansion screw, high racks, newer devices such as a power screw. The expansion screw is attached. Okay. Unplanned events in the appliance category can include breakage of the TAD MARPE connection. So the disconnection between the TAD itself and the appliance. The welding spot fracture, loss or breakage of the fixation screw is a common failure. The worst clinical consequence of such events would be swallowing or aspiration of the MARPE appliance. Very, very difficult, very, very rare. This whole thing would have to come out, and then you'd have to swallow it. Oy. It's important to mention that when the expander is activated, precaution must be taken to secure any small components, such as the activation key, using the dental floss. There we go. Let's take a look here. Pain and soft tissue impingement due to loss of a fixation screw, posterior screw cap, and also fractured. These events were attributed due to excessive resistance with the patient in the skeletal maturity stage E. So it's even a more mature stage. Kind of hero orthodontics, but if a patient has a skeletal discrepancy, which this patient does, they're basically trying to do their best to exhaust all their options before having to extract teeth. This one's rather interesting considering that, a tooth is already missing on this side. I don't know what the patient total case is, but if they extracted a premolar on this side, you would have plenty of room to fit this lateral incisor in while maintaining a decent inclination of the incisors. So as far as the patient, here we go. Some of the most unwanted events related to the host: the patient's individual biology, anatomy, and thickness, tensity, degree, If no maxillary expansion occurs in a particular patient, the best that can be hoped for that there were no adverse side effects. We have seen a substantial number of reports of asymmetrical expansions in all directions, including asymmetrical zygomatic expansion, resulting in significantly altered aesthetic appearances. I have seen that before in my case, where the case that I took over, where the patient had a MARPE and was in a big crossbite, but it was really the patient's like lower jaw is actually asymmetric, and they're trying to do a non-surgical way to correct the upper jaw to accommodate the lower jaw, where one side is too wide now and the other side is still quite narrow, I'll say. Did our best to just finish the case as best we could. The patient was thrilled still with a smile. We got it in a good point. They were happy. Papilla loss, vomer fracture, which is part of the nose, including nose bleeding, orbital fracture with partial or temporary sight issues, resulting double vision cranial base fracture involving leakage and cerebrospinal with unaesthetically wide nose shapes and even tremors. Wow, that's a lot of, these are probably clinical case reports that have been reported of things that can happen and go wrong. A lot of it is definitely about case selection. If it is the right type of case, a 3D image seems to be a must before you put one of these things in to assess the skeletal maturity. And I'm curious what the research is going to be in the future for what is the predictable time point of skeletal maturity, and is it correlated to a certain age? So maybe perhaps based on age, maybe someone is skeletally mature, like let's say stage A is the least skeletally mature, and that means like they're like 8 years old. Stage B, C, A, B, and C, let's say C is at 12 years old, and let's say stage D is like 15 years old. Is there a correlation between that one? I'm not quite sure yet. I think the research is still out on that one. In this case, asymmetric expansion became evident during the MARPE. Patient experienced pain and developed a fever. Fracture of the skull base was detected by means of cone beam computation. Wow, it's pretty intense. At the base of the skull, supposedly something was fractured. Like it's a lot, guys. I'm not really big into some hero orthodontics. Like I say, this is just cases that I'm just trying to share, man. Things that can go wrong. More commonly, as a case of adolescent girl, significant facial asymmetric expansion. One side of the maxilla and surrounding structures did not move at all, resulting in noticeable facial asymmetry. This was resolved without any long-term side effects of the patient. Well, thank goodness. So in this case here, these are different cases, of course. Right here, MARPE spine was expanded in one visit. After asymmetric, patient experienced pain and fever. Fracture detected by at the junction between cranial maxillary facial orbit. What they're showing here is the expander. So they know that if they get a nice diastema here, when it splits, it should be enough to create enough space to get these lateral incisors in and tuck these in. So yes, they might have gotten the split, it seems like. But in that process, after they sent this off to by radiologist, they can see that right here at the base of the cranial maxillary base and orbit right here was actually a fracture. Not quite sure how it was treated after that one, but like I said, was there any long-term side effects? Let's take a look at this side. TADs were placed. There's the appliance there, and a significant amount of crowding to where the entire canine is completely blocked out. So they're going to turn this key, and it looks like they did get a good size split right here. Great, you got your split. That's probably about like a good bare minimum 6 millimeters. The width of this is like 7 to 8 millimeters for this canine. So consolidate your spaces, shift everything over, plop this right in. Figure A, MARPE was installed. Asymmetric expansion. One side of the maxilla, circummaxillary sutures did not move at all, resulting in significant facial asymmetry. So what this means is one side circummaxillary sutures, which is right here, one side did not split or did not, come up. So yeah, split essentially to allow the maxilla to really expand. So only one side expanded. Based on the pictures here, it looks like just her left side is what split and expanded. So conclusion, bone-borne expanders, MARPEs, have been open to new possibilities for treatment. Yes, I 100% agree. The options are definitely a lot more open now. Effectively treating and addressing limitations, side effects associated with tooth-borne maxillary expanders, especially in late adolescent patients. Yes, it definitely opens the door for a safer, predictable option for the right kind of patient that is like a little too skeletally mature for a traditional expander. It is essential for clinicians to understand that this method is not without risk. It requires precise diagnosis, well thought out appliance design, careful selection of TAD insertion, age-appropriate activation protocols. We're also gain knowledge of diagnostic procedures in the area. So here's another example. For TAD MARPE appliance, traditionally constructed using wires, welding in combination with conventional hybrid screw. Appliance can be overloaded due to flexibility and excessive resistance of the mid-facial maxillary sutures, resulting in numerous side effects and damage. A digitally designed SLM printed MARPE appliance and more rigid construction, updated expansion screw design. Apart from the improved diagnostic and occasional need for surgical assistance, appliance design plays a crucial role in order to minimize unintended issues. So, just want to broaden up this thing. I'm not sure what the bite was like, but I guess there's a little bit of expansion between this two. I'm not entirely sure. It looks like did they just traverse through the bone? I'm not entirely sure, everybody. So there are plenty of cases where the MARPEs are great. It's a great appliance of it. And it's not, no appliance is like entirely perfect. This is still relatively new. Doctors will continue to kind of, most likely push the boundaries and try to help as many patients as possible. I mean, the alternative is you live with a particular bite that's a little bit off, or you get it corrected. And the other options would be to actually go into the OR to get this expansion done, or maybe premolars would have to be extracted, which is not entirely the end of the world. I personally had premolars extracted. I'm perfectly happy with my smile. But yeah, no. But thank you guys very much for tuning in. Be sure to, click the like button, subscribe, stay on the lookout for future episodes here at Excelsior Orthodontics. Again, my name is Dr. Minh, coming at you from Purcellville, Virginia. Look forward to seeing you guys soon. Bye, guys.